Well, actually, it is a flow chart where I basically say trace the pathway of a sperm from where it's made to your bed sheets. It's the truth.
I had some good laughs about that earlier.
Okay, so reproductive system. We'll start out with the easier gender, which is going to be male. Females are very complicated, and it's because we have a lot of different things to discuss, a lot of moving parts. But when we're talking about your sex organs, there are primary and then there are accessory. Primary sex organs are the ones that are your gonads, your ovaries, and your testes. Pretty much everything else is an accessory. Now, I would beg that probably, I bet the men in this classroom would beg to differ, that their penis is not considered an accessory. But ask Lorena Bobbitt, and she would say, yeah, it is. So it's not actually part of your primary sex organs. The gonads are both exocrine and endocrine. Why is that? They're endocrine because they release hormones, but they're exocrine because why? They release something that will end up on our sheets. And that applies for both men and women. We ovulate, ladies, and that oocyte has to end up somewhere, whether it be on a tampon or in the toilet or on your clothing, but you ovulate, and if it's not fertilized, that comes out of you. The male reproductive system is first, and this is the pathway of the sperm. Apparently, some of you have already mastered that. I say practice it in real life. Why not? As you are ejaculating or as you are masturbating before ejaculating, go through the whole pathway. If that doesn't kill your erection, I don't know what will. But your sperm are made in the testes, guys, and then they are stored for about 20 days in the epididymis. And that's approximately how long it takes for the sperm to actually become mobile and have their swimming capabilities. When a man ejaculates, he ejaculates from the epididymis, not from his testes. So the epididymis is a maturation and storage site for sperm. And I'll go over that some more. The Ductus Deferens, also called the vas deferens, has layers to it. It has a muscularis mucosae that helps propel the sperm during ejaculation. Then we'll talk about the ejaculatory duct, which is basically where we have the prostate and its duct merging with another duct, and we'll talk about that. Then the 3 parts of a man's urethra, we have actually already talked about that, but we will review them again. And then finally out through the penis. And the penis, for such an amazing, beautiful structure, there are a lot of parts to it. Accessory sex glands include your seminal vesicles, which produce about 60% of the ejaculate. The prostate gland, which produces about, 60%, yeah. Then the prostate gland about 30%. Then the bulbourethral gland is about 5%, and then sperm is actually 5%. So the seminal vesicle, for such a tiny little thing, produces most of the ejaculate. As we go through some of these slides, I will pause and offer you some tidbits that you might not have already known or were too afraid or embarrassed to ask. We'll talk about really comfortable things right up there with discussing religion. We'll talk about circumcision, to do it or not to do it, and how the women feel about a circumcised man versus an uncircumcised man. That's always an interesting discussion. And did I tell you about my husband?
Yes.
Yeah.
And how I didn't know? Yeah. I know, right? I was making sure because you all meld into each other. So yeah, I teach this, and I was sure he was circumcised. Clearly, no. Anyway, I'm sure Prince Harry and Meghan Markle are having this very discussion right now, or if they haven't already. We'll also talk about getting a vasectomy, whether to do it or not. The answer is yes. Yes. It's not that hard to do. I used to do it all the time on male mice. Not that hard to do. I offered to do it for Honey, but he said no. Vulvourethral glands. What? You don't think I could do it? Yes, I can. If I can do it on little mice, this is a bigger target, not a problem. Then we'll also talk about vulvourethral glands, and don't worry, ladies, there's enough for us to talk about your side of the house too. So when we're talking about the testes, it is both exocrine and endocrine, as we already talked about. There are some layers around the testis. There's a tunica vaginalis and a tunica albuginea. Alb means white, so it's this white surface here. And the tunica vaginalis has a parietal layer and a visceral layer, very similar to what we saw for other serosal lined cavities. And the reason why we see this similar appearance is because the testes actually develop at roughly the same area as the kidneys do, and then they have to descend through the inguinal canal. We'll talk about the inguinal canal. We'll talk about inguinal hernias. And if your little boy has an inguinal hernia, I'll tell you what to look for. It's a dead giveaway. The tunica albuginea, this white stuff, actually has septum, septi plural, that invaginates between the functional units, I shouldn't say the functional units, but these sections of the testes called lobules. Within them, if I were to cut it, you would see the functional units called the seminiferous tubules. Have you already studied this in histology? It's probably this week. So I'll tell you about the seminiferous tubules in more detail because I bet you're going to have to look at those under the microscope soon. So these lobules have these seminiferous tubules. This is where the actual sperm production occurs. Out here at the edge of the circle, that's where the cells are very immature. And as the sperm mature, they move to the center. And these sperm are still not mature. They still have to finish maturation in the epididymis. So there are different stages of maturation, and I'll talk about that in a moment. The epididymis has a head, a body, and tail. What other organ in the digestive tract has good? And again, the epididymis is going to be a site where we again see maturation of sperm, where they gain their ability to split. Now, the seminiferous tubules, these circular structures, here is an EM picture of the seminiferous tubule. Again, you can see in the center what's starting to look like sperm with their long tails. Out here along the edge, we have immature sperm, and they're going through meiosis. And I encourage you to review your meiotic stages. Remember, there are 2 cell divisions in meiosis. There's a meiosis 1 and a meiosis 2. In meiosis 1, we have unique features like crossing over, where there is exchange of genetic material. We also have the separation during anaphase 1 of the homologous chromosomes. And then in meiosis 2, we have separation of the sister chromatids. Associated with the seminiferous tubules, we have support cells. One of the support cells can actually be in the seminiferous tubule, and those are called sustentacular cells. Think of their sustaining spermatogenesis. They're also referred to as Sertoli cells. Outside of the seminiferous tubule are Leydig cells, which are also referred to as interstitial cells, which means in between the seminiferous tubules. The Leydig cells, they are responsible for responding to luteinizing hormone, that's LH. And as a result of LH, they produce testosterone primarily, with a touch of estrogen. The sustentacular cells inside, they respond to FSH, follicular stimulating hormone, and their job is to sustain the development of the sperm as they go through their meiotic division. So they are providing chemical signals, nutrients, etc. Now, like I said, out on the periphery, we have immature sperm cells. The most immature is the spermatogonium. Those are diploid. They are still going through mitotic division. They're considered to be a stem cell. They replicate, divide for virtually the entire lifespan of a man. When they divide, they'll give birth to two daughter cells. There's one that's a type A and one that's a type B. The type B is actually going to enter the pathway to start developing into a sperm. The type A is going to remain as a precursor cell, one that can still be mitotically active. The type B spermatogonium is going to enter meiosis 1, and when it is entering meiosis 1, we call it a primary spermatocyte. The way I remember that is a primary something is entering the primary phase of meiosis, meaning the first phase. They're entering it. When we exit meiosis 1, we have two secondary spermatocytes. And secondary means they're going to enter meiosis 2. At the end of meiosis 2, we have 4 daughter cells that are haploid, and those are called early spermatids. They have to go through another type of maturation process called spermiogenesis. The early spermatids start to go and develop their tails, and that's what you're seeing here, those tails. And as they go through spermiogenesis, they shed this cytoplasm. They get more and more refined, so the nucleus gets very compacted. And at the end of it, they are fully functional, hopefully, spermatozoa. Spermatozoa are haploid, just to say that again. Yeah.
And what was the stages before the spermatozoa?
Before the spermatozoa, late spermatids.
Late.
So as I told you, we actually have to have the testes emerge out from the abdominal cavity through an inguinal canal. And there is an opening, the inguinal canal is in your inguinal region. Yes, ladies, you have one as well. And there is an internal opening and an external opening. And the testes have to migrate through this through an oblique fashion, and then they drop out into the scrotum, or as my boys like to say, the nad bag, for the gonad bag. So your nad bag, or your scrotum, has the following features. Clearly there is skin, but there's also something called the dartos muscle. And this is smooth muscle, so you have no control over it, guys. That is a muscle that can actually help, it will contract and actually elevate your testes if they are getting too cold. It also can relax and allow your testes to descend even more further away from your body, because spermatogenesis has to occur at a temperature roughly 3 degrees lower than body temperature. So guys, if you're wearing tighty whities, huggers, okay, then your testes are being held too close to your body, and you might have a problem impregnating someone because your sperm might not be fully developed. I am not saying to use that as an effective form of birth control. I am not. I'm just saying it could be a factor. Also, spending too much time in hot tubs can also impair your viable sperm. And again, I am not saying that 20 minutes in the hot tub is an effective form of birth control. It is not. How many of you like to cycle, as in bicycle, like miles and miles? And you get your saddle time, which has a totally different meaning. I know that it's confusing right now, but if you are a cyclist and you are compressing your scrotum and your testes, that can also impair the viability of your sperm. Keep all these things in mind, ladies, if your guy is having a problem getting one to quote stick. So here's a picture of an inguinal hernia, and you can see that some of the intestines are slipping through that inguinal ring. There's a deep inguinal ring, that's the entry point inside, and there is a superficial inguinal ring. And the intestines can slip out into your scrotal sac. That is dangerous, and it is painful because your intestines can be strangulated from that inguinal ring. It is pain, you'll know, and plus you can feel your intestines in your scrotal sac, which is kind of gross. And if it's typically an inguinal hernia, can be found the most in young boys where their inguinal canal has not been replaced with connective tissue. It hasn't turned into an inguinal ligament. You'll know your little boy has an inguinal hernia even before they can talk, because they'll go around your place, they'll be humping everything. So don't go, yeah, high five, look at my little guy. He already knows what to do. That is not it. They are humping everything because it helps relieve the pressure and the pain from that inguinal hernia. Take them in. It's an easy, minimum invasive surgical procedure. They basically have to tuck everything back in and do a little stitch so that it stays where it should be. Now, that being said, you also can have your testes, guys, slip back up into your abdominal cavity if your inguinal canal stays open or patent. If you have an undescended testes or testis, you need to rectify that. You need to have that fixed. It is virtually a 100% guarantee that you will have testicular cancer if you do not get that addressed. It is very, very important. So, one of my kids, and I'm pausing this. Okay, there we go. So again, an extension of the internal oblique is the cremaster muscle, and it is voluntary muscle. There are several things in the spermatic cord. The spermatic cord should be on your lab hit list. It should be. And you should know the items that are found in the spermatic cord. It is not just the cremaster muscle, but we also have lymphatic drainage. That's really, really important. We talked about elephantiasis when we talked about the immune system. And if those lymphatic vessels are obstructed by that roundworm that I told you about, then you can get a lot of scrotal swelling. The Ductus Deferens is also part of the spermatic cord. We also have a vein, but it's not a vein. It's more like a net, like a fisherman's net, and that's called the pampiniform plexus. And deep inside, you can see the testicular artery. So that's another one, or another item that's in there. I have that right there. And then we also have nerves that are shown here in yellow. A lot of people don't understand that the testes are definitely innervated, but every guy in the room will say, yeah, they are innervated. It can cause excruciating pain for them if we kick them there too hard, ladies. There is both parasympathetic and sympathetic innervation. And we should know from our lecture unit 3 what sympathetic and parasympathetic division does. As I've already said, the epididymis has a head, body, and tail. I told you that it takes about 20 days for the sperm to move through it, and during this time they gain the ability to swim and also the ability to fertilize an oocyte. And I also told you that when men ejaculate, They ejaculate from the epididymis and not from the testes, and you can have sperm stored there for months. Which brings me to another discussion. One semester, I had a woman from another country where typically women are oppressed. And she raised her hand and she said, is it true that if men do not have sex every single day or ejaculate, it is bad for them? It can make their testes swell and basically die. And I said, no, absolutely not. Men can go for a long time without ejaculating. And she basically said, really, my husband told me no, that he had to have sex every day with me or it would be painful for him and his testes could die. I said, and I was actually at that moment pretty scared to tell her the truth because I had visions of her husband showing up to say, what the hell are you doing interfering with my marriage? This is the United States, buddy. Anyway, it was as if steam was coming out of her ears. The women in the classroom were extremely agitated, like they just wanted to kumbaya around her and rally, let's lick her tears, let's rally around her. And the men in the class, I could tell, were a little bit conflicted, like, the husband had a good thing going, but not the right thing to tell her. We appreciate that. If you do not ejaculate, guys, the sperm that are getting past their shelf life are just merely reabsorbed and recycled for parts. You will not have an enlarged scrotum. You will not have any complications. And what's stopping you from rubbing one out? Right? You can do that on your own. You don't need a hole.
What about blue balls?
Huh?
What about blue balls? Have you heard the term?
Yes, I have heard the
I'm
term.
actually just curious.
That's more referring to coitus interruptus. Of course, that is uncomfortable. Of course, that is. And women can experience that as well. Right? It's aggravating. We look forward to the finish line. If we're working all that hard for the finish line and it doesn't come, well, no pun intended. It's very frustrating. That's sort of like when I say when you want to sneeze and you can't, it's like the orgasm out of your nose. I hate when I'm like, I'm going to sneeze, and then it doesn't happen. It's just coitus interruptus for the nose. I understand. I understand. So go roll over and finish. I
mean, there's not, like, some circumstances, this just like
a little awkward.
Jacking off with.
I'm glad you know that.
It's kind of frowned upon. Kind of.
If socially unacceptable and it could get you arrested, then yes, you should probably refrain.
Blue balls, it's okay.
Yep. Unfortunately, that's going to happen, right, from time to time. But it does not mean that it's going to atrophy and die. Yeah, that's good to know. The Ductus deferens, also called the vas deferens, is an extension off of the tail of the epididymis. This travels up through, it is part of the spermatic cord. It goes back into your body, guys, through the inguinal canal, loops over the ureter, and I highly recommend you find that model in the lab. that has the model of the 2 kidneys with the adrenal glands on top, with the ureter coming down to the bladder. Then you see the bladder down at the bottom of the, and it's a cute little model. And I always point to it and I say, does anyone know what gender this model is representing? And most students go, no. Yeah, look at it. There's a prostate there. And you can also see the Ductus Deferens looping over the ureters. And I have seen that model be used and tagged for the Ductus Deferens. And it's completely out of place because you don't see any other male reproductive organs or accessory organs to go along with it. So make sure you see it and you can identify the ureter versus the Ductus Deferens. So when it loops over the ureter, it's going to merge with the seminal vesicle. And when that happens, it creates the ejaculatory duct, and then it turns into the prostatic urethra, membranous urethra, and then the penile, also known as the spongy urethra. You heard me say that it does have a muscularis, which helps propel the sperm, but it also has pseudostratified ciliated columnar, which the cilia will also help propel the sperm during ejaculation. So let's talk about a vasectomy. And a vasectomy is where they cut the Ductus Deferens. The question is, where do they cut it? They cut it, what they'll do, guys, when you go in for this procedure, and notice that I didn't say if you go in for this procedure, it's when. When you do, it's an outpatient procedure. It will take less than 5 minutes. The prep you have to do will take you longer than the urologist performing this surgery, and it is a urologist that typically does this. You have to shave down there and make it smooth. You also have to wash with a certain kind of soap that doesn't leave a lot of residue. Most of them recommend ivory soap. And when you go in, you'll be in the stirrups, just like the ladies are familiar with. Your penis will be laying down on your stomach. They'll take your scrotal sac and they're going to cut on the back side of it, not the front side, so that it's more aesthetically pleasing because it's going to leave a tiny little scar. So they'll make 2 incisions into your scrotal sac, and then on each of those, they're going to pull out basically a piece of the Ductus Deferens. And they'll snip out, they'll make 2 cuts on each Ductus Deferens. They'll take out the section that they've cut. Sometimes the urologist has you hold this little plate, this metal plate, and they'll put the 2 pieces in front of you so you can verify that they have done this surgery. It used to be that they would just snip it and then sew you up and you'd be done with that. They no longer just cut it. They cut out a section and remove it and show you, because if they just cut it, the 2 ends can grow back. And if you're going in to have a vasectomy in the first place, the last thing you want is to have it be reversed on its own. They will then cauterize those 2 ends of the Ductus Deferens, so you'll smell some flesh burning from the cauterization. And then they'll give you a stitch on both sides, and you eat ice cream with a fork for the rest of the week. You have no physical activity until the stitches, that wound heals, and you ice your scrotal sac for about a week to reduce the inflammation. Good? Yes.
Is it reversible? Meaning, like, can you get it, like, if you wanted to have kids later?
So if you want to have it reversed, another option is they could put a little clamp around it. And so if you want it reversed, you take the clamp off. You still need a doctor to do that. You can't just go. But if you actually get it cut with a section of it removed, those are very difficult to reverse, because now we got to pull these sections next to each other, kind of tighten those tubes, and that's arduous to do. Not only that, but when you have this kind of surgery, it can introduce blood flow to the region, and you can actually start getting an immune response to your sperm. So any sperm that are made might be attacked by your immune system.
Do you still ejaculate?
Absolutely, and I'm glad you asked that because that is a very big concern for a lot of men. Will everything be like it is usually? Yes. You still get an erection, you still ejaculate, and most of your ejaculate is still there because you're only going to lose 5% of your ejaculate. 95% of that volume will still be there. So yeah, it's not. Plus, can I just tell you, the sex is even hotter when you know you can't get pregnant. I'm just putting that out there. After the surgery, they'll send you home with a little conical tube because after about 2 weeks or so, and they want you to not have sex, but they do want you to masturbate. I see you all too. They want you to masturbate and flesh out the tubes, if you will. And then after so much time and so many times of doing that, they'll want you to masturbate and ejaculate into that little conical tube and bring it in so that they can actually do a microscopic check to make sure that there aren't any swimmers in there. Now, a lot of men don't go back to verify that. And you can actually there have been instances where some men have had a third Ductus Deferens. This is not very common, but it does happen. And no one goes hunting around for a third Ductus Deferens. So they'll cut 2, leaving 1 intact, not knowing it's there, and the man is still fertile. Semen and ejaculate are synonyms of it. Good? Anybody going to sign up for a vasectomy? It's a lot easier, guys, for you to handle that side of the house than for women to have, quote, their tubes tied. It's all. Huh?
Tied is a better
No,
word than
honey.
tied.
No. They still, even if they do a laparoscopy, would they go in with these things? Let's get tongue-tied on that one. A laparoscope, thank you. So they go in, basically, they make small incisions, multiple incisions into the woman's abdominal cavity. That means they're cutting through abdominal layers. And they go in with these little scopes and snippers and holders, so they basically can hold up their uterine tubes and then cut them. So we still will have multiple incisions. They're tiny. They can be covered with a Band-Aid, but we're talking about cutting through thick layers of muscle to get deep into the uterine tubes. So trust me, that you all guys doing it, it's a lot shorter of a procedure. It's a lot easier. The recovery is easier. Man up and do it. Yes.
Can you rank it as if vasectomy for a woman and if they wanted to reverse it at all?
So to get back to the whole clamping idea, another issue with clamping is that when you clamp a tube together, it can stick and start to grow connective tissue, scar tissue, which means that's going to be difficult to open up. Ladies, you've got something else you can do to prevent pregnancies that does not require surgery. You can always take the hormonal approach, which means you're tricking your hypothalamus, remember, into thinking that you're already pregnant. Right? We still have yet to develop the man's equivalent of the pill, huh? Yes.
When it comes to the spermatic cord, which wall does it pass through?
The spermatic cord travels through the inguinal canal.
Okay.
Okay. And I've already said that we have 3 parts of the urethra. We have the prostatic urethra. And the prostatic urethra is joined by the ejaculatory duct. Then we have the membranous urethra and then the penile/spongy urethra. The accessory glands that I was telling you about before, the prostate gland is going to generate approximately 30% of the ejaculate. What is in it? Basically, these accessory glands are producing things like nutrition for the sperm as they go through their journey. They need sugar. It will also they also have immune suppressant factors. The female's internal reproductive tract is a very hostile environment. And our immune system, ladies, is quite well attuned to kill off anything that tries to enter us, sperm included. So the men's ejaculate has evasive maneuvers, basically, to suppress the woman's immune system. Some studies suggest that when a couple is infertile, it could be, in rare cases, that it's the man's lack of these immune suppressants and the woman is basically killing off the sperm. Let's see, what else is in there? Immune suppressants, mobility enhancers. It's weird to think that the sperm clot, but they do clot. So once they are ejected into the woman's vagina and the sperm starts swimming up into the uterus, they actually can start clotting, and then they need factors that allow them to become liquefied again so the sperm can swim some more. It's kind of weird. But when I used to have to mate mice, I'd put a male mouse in with several female mice and give him like 15 seconds, because that's all it took for him to impregnate like 8 female mice. You just counted the squeaks. It was like, and like, okay, you're done, and next cage. About a week later, not even that, a few days later, I'd come back and take these female mice and I'd lift their tail and I would look for what's called a mucus plug. And that's basically this, it's very similar to clotting factors where it's making the sperm trapped, and in other animals, the mucus plug also impairs the ability for another male mouse to ejaculate and release his sperm into the female mouse's reproductive tract. So that mucus plug is like a barrier. Bulbourethral gland, very small, the size of a pea, shown here. Bulbourethral glands will contribute about 5% to the ejaculate. It is considered to be the pre-ejaculate. The purpose of the bulbourethral gland is to cleanse the urethra, because the urethra in a man carries both urine and sperm, but not at the same time. Didn't we talk about that? I thought so. Not at the same time, which is good because we ladies would like to know what to expect. We don't want sperm. Oh wait, we don't want.
Whoa, Kara.
We don't want urine. We want sperm. That's what we want. Please don't pee in us in any orifice or on us. That is. Well, some people. I know. I was going to say it's aberrant, but how judgmental of me. Moving on. Okay, the penis's only job is to deliver the sperm into the vagina. That is its only job, which sounds like it's belittling its function, but that's pretty much it. I mean, it's got the urethra, which can also emit urine. We've got different parts of it. We've got the enlarged tip, that's called the glans penis. There are glands on there, the equivalent of sweat glands, and the secretions that they're making is called smegma. So that's a real thing, you know. Then we have foreskin, also called a prepuce, around the glans penis, and that is the part that's removed during a circumcision. So, to do it or not to do it? That is the question. Victor, I don't know if that means don't talk about it or don't do it. I don't know what that means. In the United States, we are close to about a 50-50 call, meaning about 50% of the men in this room are circumcised and 50% roughly are not. Other cultures, they do not practice circumcision, and we are a melting pot, of course. So it is approximating 50-50. Most psychologists would recommend, if you're making that decision, that the child look like daddy. That's what most recommend, because the child is going to associate them. I mean, they take their baths and showers sometimes with their parent, so they associate with that the most. It does not mean that if a man is uncircumcised that they are unclean in any way. That is not true at all. It does not mean, ladies, that if you have sex with an uncircumcised man, that you will be more likely to get some sort of uterine infection or vaginal infection. It is not at all to be considered. You can have sex with anyone or anything and get a vaginal infection. It's not necessarily that they're uncircumcised. So then why did our country here push for that so much? Well, of course, of course there are religions that practice that and push for that, but also not too long ago, the military, if a man entered our military and was not circumcised, they would mandate that he had to get a circumcision, because if they were out in the field, in the bush, in the jungle, and they weren't able to shower and have, personal health care, then they could get an infection underneath the prepuce, because that smegma is basically oily secretions, and bacteria can get trapped there, and then there can be an infection on the glans, penis on the tip, which is not fun. So they would mandate that they had a circumcision, but that is no longer mandated now. It's not really a concern. It's just basic personal hygiene, and it's not any more of a risk than if a man is uncircumcised for a woman to get an infection. Any questions about that? Okay. Do you know how they do a circumcision? There are different methods. They can do the bell method, which is basically where they put this cap on the tip of the penis, and then it basically suffocates the tissue of the prepuce, and after so many days on there becomes black and necrotic, and then the whole thing falls off. Not the whole penis, but the prepuce falls off. They also can use laser, which is very quick, but there have been risks with that, because one slip of the hand and your son is now a daughter. That's not, that's not really, but the penis has been in the past cut off using laser accidentally. The most common way to do a circumcision is basically to put the child in the equivalent of a car seat, and in the middle where the legs are spread, that plastic part to separate the legs, it's a bigger wedge to really spread the legs. They'll basically give the infant a pacifier. They'll dip it in like sugar water, give it to the infant, and then they'll cut it, like they'll hand cut it. There is no anesthesia. There is none. And it is the equivalent if I removed your fingernail by cutting it off your nail bed with no anesthesia.
You can't have the child go under anesthesia.
You can, but that is not typical, because that also has a set of risks, because the child's medulla oblongata is not mature. They are more sensitive to anesthesia, and they could stop breathing. It is pretty easy to overdose them.
How old would the range be?
How old?
For young, are we talking? Or
Birth, like kiss them and goodbye. So they'll do the APGAR scores. They make you sign a lot of forms. Initial here. Are you sure? Are you sure? Are you sure? Are you sure? And it's usually when the pediatrician comes to assess the infant. So if you birth the baby, that's your OB-GYN. The pediatrician, depending on if they're on call, has to look over the baby first before the circumcision is done. So it can be in minutes to hours, depending if the pediatrician is in-house, or it could be the next day if the pediatrician had already done rounds and now you have to wait for the doctor to come back the next day. What?
Or 8 days.
Or 8 days. Why? I mean, was that?
My pediatrician did it in his office.
Oh, okay.
So.
And there's that, yes. Or you can actually choose to wait and say to your son, you decide if you want it done. If you want it done for your high school graduation, mommy and daddy will pay for it. I'm being facetious in that regard, but I mean, you can basically opt to say, I want my child to make that decision. There are hundreds of thousands of nerves at the tip of the man's penis, around that prepuce. So you cut that off, and there have been studies done where men had a circumcision later in life. They had sex before and sex after, and they all document that the sensitivity was definitely reduced. So keep that in mind. Circumcised or not. Okay, so let's look at the Lorena Bobbitt profile of the penis. If I were to cut off the penis and you look at it dead center, this is what it would look like. There are dorsal arteries, veins, and nerves. And what is the dorsal side of a man's penis versus ventral? Okay, you ready? Ready? Okay, got the visual? Okay. Well, I'm not about to ask you to come up here and drop your pants so I can say, now we see.
Well, of course not. You're trying to put the video on YouTube.
Yeah, that's the reason why I'm not. So, if this is a not erect penis, this is actually the dorsal side, and this is the ventral side, which is weird to think of. And the reason why anatomists call this the dorsal side, even though the guy's like, that's ventral, it's because when they were studying the anatomy on cadavers, the penis would be up on the man's body, and so this is the dorsal side and that's the ventral side. Now you know. These are erectile bodies. You have 3 of them, and there are arteries in these 2 that are paired. Those are called the corpora cavernosa. Those are the ones that get engorged with blood when a man is having an erection. And then here is the corpus spongiosum. There is no artery in there. That's the urethra, but that is still considered to be an erectile body. So all of them engorged with blood. Have you heard of erectile dysfunction? Okay. Very common. Very common. So guys, again, man up. If that happens to you, you go into your doctor, you say, I've been having some issues, not all the time, but sometimes. Before you even finish that sentence, the doctor will say, all I need you to do is do your blood work to make sure that there aren't any issues in your blood that would prohibit you from having this active sex life, and you've got a prescription. It is not difficult to do. And there are different kinds of erectile dysfunction drugs. But the way that many of them work is in the following. The way that these arteries get blood flow to them is through a special kind of neurotransmitter. What is a neurotransmitter I asked you to know about for skeletal muscle? Acetylcholine. So the neurotransmitter that's used in a man's penis is nitric oxide, NO. And nitric oxide is not stored in synaptic vesicles because it can actually get through cell membranes. So there's no way to store it and then release it. It's kind of made on demand. So the nitric oxide, when you take pills like Viagra, for example, it will block the enzyme. It will block the enzyme that degrades nitric oxide. By blocking the enzyme, and this is not a new concept for you at all. Back when you learned about skeletal muscle contraction, you learned that one of the things you needed for muscle relaxation was you needed the enzyme acetylcholine esterase to degrade acetylcholine to remove this signal. Well, if you take a drug to block that enzyme, then the signal remains. Viagra and other drugs like it block the enzyme that degrades nitric oxide, making it last longer so that you can have a longer lasting erection. Can I tell you about the world's most poisonous, lethal spider? Do you know what it is? Nope. Nope. It's the black widow is the most. The black widow is in the North America is our most deadly spider, but it's not the most deadly spider in the world. Most deadly spider in the world goes to what is sometimes called the banana spider. Brazilian wandering spider is the proper name. And this spider can get so big that if you were seeing it walk in the street, did you hear me?
Mm-hmm.
Walk, crawling in the street, like along a curb. So think of this baseboard as the curb. You would see it from across the street crawling. That's how big it is. When it bites, the way it kills people is it causes profound release of nitric oxide. And when that happens throughout your whole body, all of your blood vessels everywhere vasodilate and you lose blood pressure. And you don't get any blood flow to your brain and you die quite quickly. Now, men who are bitten by this spider show up in the morgue stiff for more than one reason. Because the poison also causes their erectile bodies to swell and engorge. So they show up in the morgue with an erection. So some scientists are now going, aha, let's take the poison of the Brazilian wandering spider, but modify it so it doesn't kill the guy. We'll get more nitric oxide release and we'll bind it to the Viagra medication, which will block the enzyme, making the nitric oxide to last longer. So are you hearing this? Get more nitric oxide and make it last longer. Guys, how much time do you need?
4.
What? Are you looking at the spider? All I saw was a hand. I'm like, what are we showing right now? Yes. Anyway, we will talk about the female's reproductive system and where the G spot is. You all know where that is, right? So when I lecture on the female reproductive system, I will wear a skirt so it's easier for me to show you where the G spot is. And I will show you, since Brandon seems to think we need to have show and tell. Okay, well, I'll just do it right now. How about that?
All right.
Okay, you ready? Ready? Ready?
Hold your head.
Let me put on my pants again. So that's why I was being facetious. How much time do you need? When dealing with a woman, quite a bit of time. Quite a while it could be before we're like, yeah, this could happen. That, and if you take us to Denny's, that'll help. Feed us first.
What is the effect if a woman were to take that medication?
So that's not actually uncommon. Women can take Viagra as well. Our male equivalent of an erectile tissue is our clitoris. And just like penises, this sounds crude, and you're a shower or you're a grower. Okay, so men are either well endowed, and then what they have just gets hard, or they might not look visually well endowed, but when they get hard, it's like, wow, where did that come from? So there are different sizes, right? There are different sizes, and same thing for clitoris. There are different sizes of clitorises. And again, same thing, you could be a shower or a grower. Which are you? Both. She knows just to like roll with it.
I'm your kind of girl.
Perfect topic.
I know.
Anyway, so some women have orgasms that are vaginal. Some of them will have orgasms that are more clitoral based and stimulant. So if it's bigger and more engorged, then it might be easier for them to have an orgasm in that regard. So there you go. Yes, women do take it. So you can have a Viagra party with your honey. Say, if you take one, I'll take one. We're ready to go. And don't take a whole pill. No, usually they'll start you out on a half a pill. You don't need a whole, don't take a whole one unless your doctor says, take a whole one. Take a half one. There's a reason why they say if your erection lasts more than 4 hours, you need to seek medical attention. And by the way, guys, once you do have, if you do take that medication and you do have an orgasm, it's not like you're going to maintain an erection for 4 hours after the effect. And if you take the medication, it's not like you would. How do I say that? I'm just gonna say it. I'm just gonna say it. It's not like taking a diuretic where when you take it, you say to yourself, I better be close to home or to a toilet because I'm going to have to go to the bathroom. When you take Viagra, you pop the pill. It doesn't mean 20 minutes later you're walking around with, just all the time. That's not how it presents at all. There still needs to be some stimulation. There still does. So it's not like you have to be somewhere private because you're going to walk around with this big, tent pole in your pants. That's not it. Still needs some stimulation. What? Sure. So, please review your meiosis and compare it to mitosis. In the seminiferous tubules, we have both going on. We have mitotically active spermatogonia, and then we also have the type B cells entering into meiosis. Spermatogenesis, where you actually start making sperm, begins in puberty. Guys, you're making 400 million sperm a day. How many sperm does it take to fertilize an oocyte? One. Talk about overkill. You're making 300,000 a minute and you ejaculate anywhere from 50 to 120 million every time you ejaculate. Half of them, if they're deposited in the vagina and they start swimming up into the uterus, half of them will make the wrong turn because, as usual, men do not stop to ask for directions. So some will swim to the wrong uterine tube. Some will swim because, ladies, we ovulate from one side or the other. Rarely do we ovulate from both, though some women can. So many of them are going to make the wrong turn, right? And then once they actually do encounter the oocyte, some die along the way. They do. Why? Because our immune system knocks them off, or they just run out of energy with the swimming. So when they get there, it's not millions of them surrounding the oocyte, and some studies have been done to suggest that there are warrior sperm that get to the oocyte first, circle around it, sort of like circling the wagons, and any other sperm that are coming up, these warrior sperm will only, somehow they select, we're still trying to figure that out, and I've only seen this on just a few papers. They'll select the sperm that is still the most viable from the trip to actually fertilize the oocyte, which is kind of weird, huh? Huh? I know that doesn't make sense. Apparently they're not as selfish as we would like to think. So on Thursday, we will have our female reproductive system. This is again another play-by-play for spermatogenesis and the bottom, spermiogenesis. Thursday, I'll tell you about the female reproductive system while you're eating. We're having our potluck, remember? Just bring a little bit, only a little bit to feed like 4 people. Otherwise, we'll have so much food and it'll be crazy. We'll set up in here, it's fine. We'll set up in here, and then after I talk about the female reproductive system, I will also go over embryogenesis, the parts of it that you need to focus on for your lecture unit 4 exam. If there is still time, I will on Thursday also give you a final exam review. If there is not time, that will be the following Tuesday, our last class time together. Okay? Okay. All right, I will see you on Thursday.